Well, Dr. Nadine Haddad, owner and medical director of B Medical Spa and Wellness Center, she joins us this evening to talk a little bit more about these so-called miracle drugs. We appreciate you joining us tonight. You are also an obesity expert as well, aren't you?
Correct. Thanks for having me, first of all.
Let's talk a little bit about Weight Watchers. You know, they used to embrace exercise and diet, which obviously is important in managing your weight, but now they're embracing the prescription drug weight loss because it's become such a big thing. What is your opinion on that? What is your thought on that?
Yeah, so to start with the medications, Ozempic and Wegovy are the brand names for the generic medication, semaglutide, which became very popular in the recent years due to its effectiveness in regulating blood sugar, promoting weight loss, and the convenience in dosing schedule.
But what's your opinion on Weight Watchers switching from this sudden, like, just diet to suddenly adding in these medications?
Yeah. To see this program like expanding beyond the traditional programs and embracing such medication is promising, and I can see this helping patient becoming more successful, losing weight, as long as it is medically supervised. I really believe this process should be supervised by qualified healthcare provider who can discuss with patient the risk and benefits for taking these medications, monitor their progress, and ensure their safety while taking this.
Doctor, in your opinion, is this kind of sending a wrong message, or what do you think?
Well, we live now in a society where we feel like everything should be quick and with minimal effort. People need to be educated that in order to be being on those medication is they're not meant for get in, lose few pounds and done, and they're not also meant for long-term use. They really should. It's a journey. Let's put it this way. It's a journey where people need to make effort in changing their lifestyle and maintaining that in order to maintain the weight loss and stay healthy.
Yeah, because we've seen a lot of these influencers on social media platforms who got on the diet, lost a ton of weight, and then gained it back triple because they literally did not think about like the medical side of it, because there are some side effects. Can you talk about some of the side effects?
Yeah, because this medication works on slowing down the stomach and intestine emptying, some of the common side effects can be nausea, vomiting, diarrhea, constipation, and of course the side effects can vary from person to person. Some other possible side effects, the hypoglycemia, because it mimics insulin, so it can drop the blood sugar. So people have to be aware of that, and that something can be minimized. Some of the risk, or some studies showed that a possibility or like rare thyroid cancer called medullary thyroid cancer, in addition to possible inflammation of the pancreas, injury to the kidney and the gallbladder.
What about diabetics? Because many of them use this drug here, and now is there sort of a competition going on, perhaps by people who want to lose the weight? I mean, who should really win out this battle, if you will?
Yeah, so like many other medications that have multiple uses, this should benefit both categories. As long as there is enough demand and supply, I think both categories should have access to that. But the problem when there's a shortage, in my opinion, diabetic patients, depending on the stage of their condition, should be prioritized. On the other hand, there are a lot of people with high BMI, with the comorbidities associated with or affected by their weight, that can significantly benefit from taking such medications to lose weight. So it's hard to say who should win. It's really we have to use judgment here to kind of determine who should have access to it.
And you know, if people actually get on this drug, they have to be monitored, and at the same time also know that it's not for long-term use.
Absolutely.
If you're going to lose that weight, you have to change your lifestyle.
Absolutely. It is very critical. People need to understand that this is not a miracle drug. It's really not. It can expedite the weight loss, but weight loss can vary depending on each person's factor, from genetics to exercise and everything in between. While this medication can make this process faster, but without establishing healthy lifestyle, once you stop the medication, it's very easy to regain the weight. And that's a very common problem.
Important things for people to know, especially because it's become such a big deal right now in the weight loss industry. Dr. Nadine Haddad, thank you so much for coming out and giving us some insight on that.
Absolutely, my pleasure. Thanks for having me again.
Thank you.